Hi Dr. Hamilton, how are you today?
Very well, thank you, Mara.
Today we're going to ask you some questions about the Revitalizing thread lift, and we'd just like your opinion on a few things.
Sure.
The first question is, the Revitalizing thread lift is a well-established procedure. It's a proven procedure to help rejuvenate the face and give a much younger look. What's your opinion on this?
Oh, look, I just think they're fantastic. Previously, before their introduction, there was only two options, nothing or having surgery. And clearly there's a group of people, mainly between 35 and 55, who just clearly don't need surgery but would love to be freshened. And the Revitalizing threads give a way for those people to be able to get an enormously good procedure and good rejuvenation, which either replaces surgery altogether or at least puts it back over time.
Thank you. Now, can you explain to us how the Revitalizing thread lift works?
Well, the Revitalizing threads are really clever. They're essentially a dissolving suture that for a few months stay in place. So you can think of them as twofold. Firstly, think of them as a bit like a Velcro. When you put them under the skin, they have a contour effect so that you can place them to give a little two-finger support here, two-finger support here, two-finger support here, or down through here. But in doing so, as they dissolve, they very cleverly leave collagen struts behind that give an internal structure, internal ligament if you like, which gives a longevity far greater than the thread itself. Secondly, as they dissolve, they leave a tiny inflammation behind, which stimulates skin cells in the area to work more efficiently, and that gives a very nice improvement in things such as texture, tone, colouring, luminosity, over and above the contour effect. The real importance about this is that we know that gravity keeps on going on over time. If we were using a permanent thread, which have less of a collagen effect, you end up having lots and lots of threads that need to be redone. The big thing about Revitalizing thread is that it does its work while it's disappeared, which means you've got a clear canvas to come back and to adjust and do some more over time with no downside. They're very clever.
That is clever. So how long would it last? How long would a thread
last? Most people a few years. Now, how long is that? I'm not sure. But let's say that somebody has just the most minor procedure in that area there. If they get 2 years out of it, good luck to them. If they get 3 years out of it, we don't ask them to send us a cake. It's a variable thing. But one thing's for sure, if people get 10 units of improvement out of the procedure, even if it's completely worn off and gone, they'll still have a residual of 3, 4 or 5 units many years in the future.
Very good. So if a patient was actually considering this procedure, is it like a facelift? Because patients do ask this question.
Look, I think it's best to be thought of as a preemptive strike. If it is that you're having facelift surgery, the implication there is that you're cutting skin away and ending up with scars. Certainly you can have a better pull, but we don't really want people to be pulled. I guess philosophically, the Revitalizing threads are about making people look better, not different. We want friends and family to be able to say, my goodness, you look well, not what the hell have you had done. So if it is that people look in the mirror again and just with two fingers do that and think, gee whiz, that looks nice, I look fresher, or gee whiz, that looks nicer there, that's where they sit. They're a stopgap which doesn't change them but rejuvenates them, and in doing so prevents the ongoing sinking and sagging that would otherwise happen without that support in place.
It's very interesting because people do fear like the facelift, and it sort of created a bit of a stigma there.
Look, I think quite rightly so. I mean, we've seen armies and armies of 65-year-olds that still look 65 but are pulled. And you know what? We just don't want that.
No.
We want people to be able to look natural.
So this is more of a soft lift, you would class it as?
Yes, look, I would just call it a full facial refreshment, if you want to think of it that way.
Okay. So how long does this procedure of a Revitalizing thread lift actually take to do?
Well, not long at all. If it is that you are doing just a minimal amount, it'll be over and done with within half an hour. If you did the most extensive full face, where you're doing multiple areas, probably 90 minutes.
Okay. And the pain, we don't want to be in pain, so is it painful? Is it a painful procedure?
Well, you certainly need to have some local anaesthetic placed in where the threads are. But within our hands, what we generally do is give people just a little bit of sedation, if you like, a little bit of giggle juice, Once we've got the local anaesthetic in, they feel absolutely nothing. And when I speak to them the next morning and ask them how sore they are, they normally say, oh, 1 or 2 out of 10 pain, just a bit tight. Certainly not 5, 6, 7. The vast majority of people, when I say, how was it? They say, yeah, no problem at all. And mind you, you won't, you know, you certainly, it isn't a walk-in, walk-out procedure, but it's certainly a 36-hour get back into action procedure.
And so the expected recovery time, what would you actually, or does that vary from patient to patient?
Look, it does vary, but essentially if people had it done on a Friday, they'd be at work on Monday. If they had it done on a Saturday, Monday may or may not be okay.
Yes, that's for sure. And what makes these revitalising threads that we're using now, because they're the next generation of threads, what makes them so different?
Oh, the fact that they're dissolving. That's really just the key to be able to now to use them more extensively, because if it wasn't, they weren't dissolving, we have no easy way of being able to get the whole of them out when they need to be replaced. Added to that, they're stronger because you get a greater collagen strut where they've been. Added to that, they've got barbs on them, the Velcro effect that's tremendously strong. The Velcro is a real good zip. It's not just a placement that doesn't hold. So there's multiple ways that these threads, the next generation of threads, have been superior to what we've had in the past. And certainly 10 years ago they were problematic. Now it's very, very mainstream with absolute predictability. I guess the BMW that we drive now is better than the Kingswood from a few years ago, and that's clearly the case here.
And you know, obviously patients are curious about the cost because they're so fantastic. You know, people that have had the threads already have been delighted. The cost factor varies as well, and it would depend on the amount of threads you put in.
Yeah, look, it's totally dependent on the patient, but if it is that people just want the smallest of little tweaks, that's probably just under or up to $1,000. And if people wanted to have the most full procedure that could ever be done, somewhere probably $5,000, $6,000 or $7,000. It's still probably a third of most facelift surgery.
And basically, that, you know, is anything else you'd like to add to this, Dr. Hamilton? Because you've done quite a few of them over your 8, 9 years of doing these threads.
Yes, look, again, I think as being a preemptive strike against gravity change that otherwise would need surgical intervention in the future, they're just tremendous. And I think that the vast majority of patients who are serious about being able to prevent themselves from the sinking and sagging we don't like would have to say that the ongoing use of these threads in a conservative way is just part and part of their maintenance regime now.
And if patients are interested in having this revitalising thread procedure, they can come and make an appointment, and you know, would you agree that a consultation is very, very important, so then they can ask the questions and you can actually see exactly what's needed?
Yes.
Because everyone's an individual.
Look, the threads themselves, as well as the different facial areas on individuals themselves, are very, very different, and they have to be matched. So for one person, what might need a thread procedure might very well need a laser or a filler procedure in the next person, where at the surface it looks like threads will do well. So they certainly need to be assessed by people that have been trained in the use of these threads. But as long as you pick the right person for this procedure, then they're, again, a wonderful tool. But you know what, like anything, if you try to get out of a bunker with a driver, it ain't just going to work. It has to be the right thing for the right person.
And you know, some patients also say, you know, I haven't got enough saggy skin, I'm not old enough to have a threads procedure. I don't know what your feeling is there, but basically I've always thought the younger you start with these things, the less you'll age. I don't know what your...
No doubt about that whatsoever. If it is, people lie on their back and have a look in the mirror and then stand up and look in the mirror. If there's any type of improvement when they lie flat on their back and look up in the mirror, then they're a candidate for some form of thread support. And whether, again, that's in late 20s, early 30s, if it is that we can do very small things very often, then people can make sinking and sagging very much optional. You don't have to go and get into a really bad situation with lots of sinking and sagging where it's hard to fix. There's no doubt that prevention is better than cure.
Thank you so much, and we really value your time, and thank you for answering the questions.
Thanks, Mara. That's great.
Bye.